Greetings. My name is Sateria Venable, and I'm the founder and CEO of the Fibroid Foundation. Welcome to today's congressional briefing announcing the introduction of House Resolution 351, introduced by Congresswoman Grace Meng, which recognizes the month of May as National Menstrual Health Awareness Month. Congresswoman Meng will join us later in the hour to deliver remarks. I want to applaud Congresswoman Meng, Congresswoman Yvette Clarke, and the co-sponsors who have shown tremendous leadership in advocating for menstrual equity by introducing and co-sponsoring the National Menstrual Health Awareness Month resolution. As a forceful advocate for period menstrual care and accessible hygiene products, Congresswoman Meng also introduced the Menstrual Equity for All Act of 2021. Congresswoman Clarke introduced the Stephanie Tubbs Jones Fibroid Research and Education Act and consistently supports health initiatives for women, girls, and menstruators. The Fibroid Foundation is a 501c3 nonprofit organization. Our mission is to amplify the voice of women and menstruators living with fibroids and to advance equity in menstrual health from the onset of puberty through menopause. The purpose of House Resolution 351 and this briefing is to recognize that menstrual stigma is a significant barrier to creating equity in menstrual and pelvic health. For us to progress as a community, it's important to erase those stigmas and to educate everyone on menstruation. The United Nations Population Fund recognizes that menstruation is intrinsically related to human dignity. Half of the world's population menstruates. In 2019, a global team of experts organized by the Global Menstrual Collective defined menstrual health as follows: a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in relation to the menstrual cycle. The definition expands to describe that achieving menstrual health implies that women, girls, and all other people who experience a menstrual cycle throughout their life course are able to do the following: access accurate, timely, age-appropriate information about the menstrual cycle, menstruation, and changes experienced throughout the life course, as well as related self-care and hygiene practices, care for their bodies during menstruation, access timely diagnosis, treatment, and care for menstrual cycle-related discomforts and disorders, including access to appropriate health services and resources, pain relief, and strategies for self-care, experience a positive and respectful environment in relation to the menstrual cycle, free from stigma and psychological distress. And finally, to decide whether and how to participate in all spheres of life during all phases of the menstrual cycle, free from menstrual-related exclusion, restriction, discrimination, coercion, and/or violence. National Menstrual Health Awareness Month will highlight the need to create and maintain educational programs and support systems for women, girls, and menstruators. Today, I will be moderating our briefing. We will hear from distinguished panelists in policy, medicine, and advocacy. Both Congresswoman Meng and Congresswoman Clarke have shown tremendous leadership in advocating for menstrual equity by introducing this resolution. Our agenda for today is remarks from Dr. Candace Tingen from the National Institutes of Health, remarks from Dr. Elizabeth Stewart at Mayo Clinic, remarks from Dr. James Segars from Johns Hopkins Hospital, advocacy remarks from Jermaine Reid, a Fibroid Foundation ambassador, remarks from Lauren Kornegay with Endo Black, remarks from Sasha Ottey with PCOS Challenge, remarks from Michela Bedard with Period, and to close us out, remarks from Congresswoman Meng. At this time, I'd like to introduce our first speaker, Dr. Candace Tingen. Since 2015, Dr. Tingen has been a program officer in the Gynecologic Health and Disease branch at the NIH's National Institute of Child Health and Human Development. Her responsibilities include providing technical leadership, guidance, and management of a research grant portfolio that focuses on the physiology and pathophysiology of human female reproduction and benign gynecologic diseases, including uterine fibroids and menstrual disorders. Dr. Tingen has also been a lead author on several peer-reviewed articles published in high-impact journals that focus on diverse areas of health science policy, including sex equity and clinical trials. Dr. Tingen brings to her position scientific expertise, policy experience, and a long-standing passion for women's health. Dr. Tingen, thank you for being here today.
Thanks, Soteria. Thanks so much for that introduction and for inviting me here to speak on behalf of the National Institutes of Health and my home at the National Institute of Child Health and Human Development. NICHD has been really proud to continue its leadership of women's health by emphasizing the importance of menstrual health as an indicator of overall well-being. We and many of our supported researchers see it as a fifth vital sign that can be probed not only as a non-invasive diagnostic for gynecologic health, but also can reflect what's going on in the body far beyond the reproductive system. There are a host of basic and clinical questions that can be probed that are relevant to fields beyond women's health. For example, menstruation is characterized by large-scale tissue breakdown, inflammation, and constriction of the blood vessels, followed by stem cell activation and tissue regeneration. These events are all under the precise control of hormones and cytokines and growth factors. And all of these characteristics mean that menstruation is a powerful model for understanding tissue loss and regeneration in other organs, as well as cell invasion and metastases that are so important in cancer. So menstrual health also gives us a measurable focal point for looking at other broader societal questions, like how do we deliver required health supplies globally, or for example, in a crisis or a pandemic? In what ways are health literacy or the stigma limiting optimal patient care? And then how are underserved populations, like women of diverse ethnic or racial backgrounds or women with disabilities, best served by our biomedical community? So in demonstration of how much we understand that menstruation is important to overall health and well-being, NICHD has taken the additional step of focusing on this process within our strategic plan, where we specifically call out menstruation as an avenue to assess, understand, and address gynecologic health. To support this strategic goal, we convened a meeting in 2018 called Menstruation, Science, and Society, in which we asked our panels of gathered experts to rethink menstruation and what we know about it, and to reimagine what we could learn from this complex biological process. All too often, the general research community and the public has thought of menstruation as settled science. Oh, we know how it works. We've known for a century, but that's far from the truth. The science of menstruation and the endometrium is evolving rapidly, and there's much more to learn, as this meeting demonstrated. It was outside our normal NIH comfort zone, but it was important that we brought together leaders from across disciplines and sectors to envision this future of menstrual health research. Speakers and attendees included the leading biomedical researchers using cutting-edge techniques to better understand the pathways responsible for menstruation, healthcare providers who treat patients suffering from menstrual health disorders like endometriosis and fibroids and heavy menstrual bleeding, NGOs that are working on the ground in menstrual hygiene management who distribute reusable pads to girls and women across the globe in hopes of addressing period poverty, and menstrual health literacy and advocacy experts who could speak to the unique ways that menstruation is understood and communicated to different populations. So we took all those important discussions from that meeting and the teams who all study menstruation from different lenses, and we channeled them into two highly cited publications. One that lays out the new advances in menstrual health research and possible new research directions that are on the horizon, and another editorial co-authored by our Institute director, Dr. Diana Bianchi, in which we called what we thought was an envelope-pushing title, Revisiting Menstruation, the Misery, Mystery, and Marvel. And it's not just my reproductive biologist bias speaking here. Menstruation certainly can be a mystery, a misery, and a marvel in turn. So that editorial really discussed the ways that the stigma surrounding menstruation can still lead to things like school absenteeism or biased policies where pads and tampons, for example, are excluded from sales tax exemptions. However, I think it also tried to capture the ways that this hidden or secretive nature of menstruation is beginning to change, including, for example, the field of femtech, which is any software, diagnostics, products, and services that are using technology to improve women's health. That field is estimated to be a $50 billion industry by 2025, which is a pretty staggering increase when you consider that the term was only coined in 2016. Also, celebrities such as Michelle Obama and Meghan Markle and many others have spoken out about menstrual health and hygiene and the impact of menstrual health disorders as critical issues facing girls and women, especially those in low resource settings. This publication was a call to action for all stakeholders that are interested in menstrual health research, as well as a recommitment by the NICHD to encourage new research insights and expand partnerships to address these questions that are still existing about menstruation and menstrual health. So we've been very pleased to be able to put our money where our mouth is in the years following this meeting and editorial by following up on that recommitment with new research projects. And today I'd just like to really briefly talk to you about two of our research supported programs that are absolutely shifting the way we think about menstruation. The first research program is centered around the incredibly exciting possibility of using menstrual fluid and tissue, which I'll refer to as menstrual effluent, as a diagnostic. Researchers in this field are putting forward the pragmatic yet provocative message that menstrual effluent is a monthly natural biopsy that can be directly collected by the menstruator, and utilizing that this previously discarded biospecimen could empower menstruators as drivers of their own gynecologic health inquiries. One of our teams is developing what they call a smart tampon, which is designed to test for endometriosis using only the blood that is normally collected from a single tampon during a menstrual cycle. So we imagine a future where those who menstruate could send off a tampon sample and receive results about their chances of having fibroids, endometriosis, adenomyosis, gynecologic cancers, endocrine disorders, or other conditions. These results could be sent by an app or an email directly to the person, to the woman who has never had to leave her home for these screenings. And that is the power of recognizing menstruation as a valuable biosample. The last program I'd like to discuss was spurred on by, like so many of our changes, by the COVID-19 pandemic. Following the rollout of the COVID-19 vaccinations, there were a few anecdotal reports of women reporting changes to their cycles and their menstruation. These reports varied, and they included changes to the timing of cycles, whether it was longer, shorter cycles, skipped periods, breakthrough bleeding, changes to the flow, or changes to comorbidities such as perhaps increased pain during their cycles. These reports were taken up by major media services such as the New York Times with various shades of uncertainty that led to some real fears. So where there was this dearth of information, NIH and NICHD saw a need for rigorous, well-designed research. So we funded $1.67 million along with a co-funding partner of the Office of Research on Women's Health that has found, and the research from that program has found, that there is a very small but increase in menstrual cycle length following vaccination. While this increase is likely not clinically significant, it could have potentially been noticed and been concerning to some women if they didn't have this explanation. So this research was essential to providing upfront understanding to inform vaccination decisions. Rather than guessing, now we could show that most women should only expect a very small temporary increase to their menstrual cycle length following vaccination, with no effect on fertility. This is the power of recognizing that menstruation can reflect overall health, and also demonstrates how vital it is to track menstrual changes in drug and other clinical trials. So I'll end today with what we hope for menstrual health research for the future of that field. Step one is for researchers to include menstrual health status in all projects, simply to ask, is the participant menstruating, or is she postmenopausal? Is she using hormonal birth control? Could the stage of her menstrual cycle and associated hormonal changes impact your research findings? We want clinicians and others to think of menstruation as a vital sign, make it a part of routine screenings or health records, but do so acknowledging that the stigma and the fact that most women don't even know perhaps what normal menstruation is. Use functional patient-centered reporting. So rather than saying, is your menstrual cycle normal, you could ask, how many tampons do you need on your heaviest cycle? Understand that as fundamental as the process is to half of our population, the science is by no means settled and there is much to be learned. And please continue this conversation because, as we said in our article, we believe that menstrual health is a fundamental aspect of health and the time of taboo should be ended. period. Thank you.
Thank you, Dr. Tingen. That was very informative. And at this time, I'd like to introduce Dr. Elizabeth Stewart. Dr. Stewart is a professor in the Department of Obstetrics and Gynecology with joint appointments in the Department of Physiology and Biomedical Engineering, the Division of Endocrinology, the Department of Medicine, and Department of Surgery at Mayo Clinic. She has authored over 190 peer-reviewed publications, 2 books, multiple book chapters, and research presentations. She provides care for patients with benign gynecologic and reproductive conditions and is a member of the Fibroid Foundation's Medical Advisory Board. Dr. Stewart completed her fellowship in reproductive endocrinology at Brigham and Women's Hospital, Harvard Medical School. Her research focuses on alternatives to hysterectomy, innovative treatment options for endometriosis and uterine fibroids, and long-term consequences of hysterectomy. Welcome, Dr. Stewart.
Thank you, Soteria, for such a great introduction, and thank you to the sponsors of this important day. But I'd like to amplify what Dr. Tingen said, that menstrual disorders are common and that the lack of discussion of normal menstruation affects everyone, not just the affected person, but men, women, and children. And there are lots of barriers. I think the work of Dr. Marsh at the University of Michigan has written and researched about the altered perception of normal, because many of these menstrual disorders run in families and in certain racial or ethnic groups, that when you ask your friends or your colleagues, gee, is it normal to have 14 days of heavy bleeding every month? Or is it normal to have bleeding every single day of the month? And you're told yes, then it's hard to seek care. Even women who are educated and have advanced degrees often don't hear about disorders such as fibroids or adenomyosis or polycystic ovarian disease. And one of our PhD students has found that this lack of discussion perpetuates the problem. Looking at cultural barriers and shame and taboos, because menstruation is linked to sex. Many women and many families don't have these discussions, and that there is secrets and shames that keep women from getting these problems addressed. And this results in major health disparities. We have written about the health disparities, particularly of uterine fibroids for African American women. And this is a pressing health need. Not only are Black women more likely to develop a disease like fibroids at an earlier age, they have a higher peak prevalence. It affects their pregnancy and fertility outcomes. It continues longer into perimenopause. And there are higher rates of hospitalization, hysterectomy, and myomectomy. And the next slide, I think, is especially informative. This is work we published a good while ago, where the rates of hospitalization, hysterectomy, and myomectomy for white women are seen in the red bars. And you see that for Black women, the risk of hysterectomy is more than 3 times greater. The risk of hysterectomy is more than twice as great. And the procedure myomectomy, which is a uterine-sparing procedure, is almost 7 times greater. And when you look at health disparities, you almost never see anything this remarkable. In fact, when I wanted to look at the risks, that the only thing that I could find in terms of racial disparities that rivaled myomectomy was homicide risk, which is startling. I think the other dialogue we need to have is that hysterectomy is not an adequate solution, and that's what's been viewed in the field of menstrual disorders for decades. It's astounding to most people that the lifetime risk in the US for hysterectomy is 45%, and only 8% are performed for cancers. So it's truly menstrual disorders that lead the drive to hysterectomy. And it's clear that hysterectomy is done more than necessary And although in the past several years we've focused on conserving the ovaries, even women who have conservation of both their ovaries have astounding increased risks of hypertension, hyperlipidemia, cardiac arrhythmias, obesity, and a 33% increased risk of coronary artery disease. And when you're keeping this in mind, most women have hysterectomies in their 30s and 40s long before their peak risk of coronary artery disease. So these are important facets that need to inform our research. So as we've looked at the risks of hysterectomy, there are risks and benefits, and the risks appear to be weighing down the benefits. So I'm very excited that this dialogue is taking place. I'm very excited that we're going to turn our attention to menstrual disorders. And I thank the organizers of today's session and the congressional attention to focusing important attention on menstrual disorders, not only for affected individuals, but for our entire society.
Thank you so much, Dr. Stewart. And I see that Representative Meng has joined us, so I will introduce her at this time. U.S. Congresswoman Grace Meng is serving her 6th term in the United States House of Representatives, where she represents New York's 6th Congressional District. Representative Meng is the first and only Asian American member of Congress from New York State and the first female Congress member from Queens since former Vice President nominee Geraldine Ferraro. In Congress, Representative Meng serves on the powerful House Appropriations Committee, where she is New York's senior member and is the vice ranking member. The Congresswoman serves as the first vice chair of the Congressional Asian Pacific American Caucus, a co-chair of the House Bipartisan Task Force for Combating Anti-Semitism, and as a vice chair of the LGBTQ+ Equality Caucus. I am delighted to introduce Congresswoman Grace Meng.
Hi, everyone. I'm Congresswoman Grace Meng from Queens, New York. Thank you so much for the introduction. And I'm really so grateful to Fibroid Foundation for hosting this panel and for the kind invitation to join all of you. To all the medical professionals and advocates on today's panel, thank you so much for the work that you do to care for and protect women's health and well-being and to build a more equitable tomorrow. This issue of menstrual equity and menstrual health is near and dear to my heart. And I actually first learned about this issue because one brave teenage girl from Queens wrote to me explaining how hard it was for people living in homeless shelters in New York City to access period products because the shelters weren't allowed to use the federal grants they were receiving to provide these products for their clients. So back in 2016, I worked with the Obama administration and then Homeland Security Jay Johnson to make sure that FEMA, which was the federal agency that administered these grants to homeless shelter providers, were able to then use federal dollars to purchase and provide these products. And from there, I worked on developing the Menstrual Equity for All Act, which is a whole of government approach to comprehensively address the unique challenges facing different populations experiencing period poverty. And we all know that lack of these products can hinder a person's day-to-day life, making it difficult to go to school, to work, and pursue opportunities that could lead to economic advancement. It can also have far-reaching implications for women's health. Without access to period products, menstruators will often turn to alternative materials, whether they be old clothes, bathroom tissues, paper towels, or using products for longer periods of time that are safe. All of these options risk the physical well-being of menstruators, and no one should be forced to make choices like these. And for so long, period poverty has been a hidden inequity of our modern world. but we have to fight this stigma and normalize conversations around menstrual health and well-being. There is a long history of creating dedicated periods to raise awareness about particular issues and challenges that our nation faces. These periods of time, whether they're a day, a week, or month, create rallying points throughout our year to bring national attention to the work and efforts that countless numbers of advocates are doing every single day. And it is in these moments that we recommit to an ideal, a purpose to improve our nation. And so now it is long past time for the issue of menstrual equity to be given such a spotlight. And that's why I worked with my friend, Representative Clark, to introduce a resolution. And thank you all for your support, declaring May as National Menstrual Health Awareness Month. So thank you all for your continued advocacy and support. I'm confident that with our efforts and collaboration, we will be able to end period poverty once and for all.
Thank you so much, Congresswoman Meng, and we are honored and grateful for your leadership and introducing the resolution. Thanks again. At this time, I'd like to introduce Dr. James Segars. Dr. Segars is the Director of the Division of Reproductive Science and Women's Health Research and a professor in the Johns Hopkins Department of Gynecology and Obstetrics. He leads the Howard W. and Georgiana Seeger Jones Laboratory of Reproductive Sciences and Women's Health Research, where he and his team focus on endometriosis, uterine fibroids, and reproductive and ovarian disorders. Before coming to Johns Hopkins, Dr. Segars was head of the unit on reproductive endocrinology and infertility at NICHD and a professor in the Department of Obstetrics and Gynecology at the Uniformed Services University of Health Sciences. Dr. Segars is a member of the Fibroid Foundation's Medical Advisory Board. He has published more than 160 peer-reviewed research articles. Welcome, Dr. Segars.
Thank you very much, Soteria, and thanks to Representative Clark and Meng for having us today. And thank you for the invitation to speak today on the problem of uterine fibroids and menstrual health. But in my brief comments today, I'd like to talk about the impact of women's health and menstruation, specifically relating to uterine fibroids, and discuss the needs of women who may be affected by fibroids. By the end of my talk, I hope to convince you that fibroids have an immense impact on the health of women and cause significant psychological and psychosocial stress. Ebby's already mentioned that fibroids are a health disparity issue, but I'd like to point out that by age 25, 25% of Black women will have uterine fibroids. Since some of the people listening today may not be familiar with what fibroids are, this slide shows a uterus that's been removed at hysterectomy and points with the arrows to the fibroids. These are the large tumors in the uterus. And it's not hard to imagine that these tumors could cause pain, increased menstrual bleeding, or lead to infertility because of their effects on the uterus. Once fibroids develop in a uterus, they tend to grow at an average rate of about 6% over 6 months. And over time, that can grow to be very large, as you might imagine, as I showed you on the previous slide. Ebby's already mentioned that fibroids are a health disparity issue, and they affect Black women more than white women, and women of color are more likely to be diagnosed at a younger age and have more severe symptoms of fibroids than white women. She showed the differences in myomectomy, but it's not only one surgery. It turns out that African-American women are more likely to have 2 surgeries for the removal of fibroids, as is shown here. The fibroid problem is complicated even further because there's a delay between the onset of symptoms and the diagnosis of uterine fibroids, which averages 3.5 years. 1/3 of women that are affected will suffer symptoms for over 5 years before seeking treatments. There are several delays and reasons for this delay in diagnosis, but the primary reason is that there is a low knowledge of fibroids. That is, women didn't realize that they exist. And then even if that is the case, 37% of women did not seek a diagnosis despite severe symptoms because of normalization of menstrual blood loss. So that's really good about what we're talking about today, how this is a problem. One patient story I'm showing here is that with the patient who has uterine fibroids, mattresses replaced dozens, tampon budget a small fortune, dates run, lost count, not to mention 5 blood transfusions, 1 surgery, and 9 weeks of recovery. So in addition to the medical problems of uterine fibroid, the bleeding and anemia that occur with fibroids, the situation is even worse because there's a psychosocial impact of fibroids because of the physical, emotional, and sexual and urinary issues that occur with the disease. The levels of disability for fibroids are so significant, they resemble the levels of dissociation of psychosocial stress with heart disease, diabetes, and breast cancer. In fact, women with fibroids were more impacted and had lower functioning and vitality scores than women who had a diagnosis of breast cancer. Younger women were more affected than older women, contrary to what you might think. And as has been mentioned before, unpredictable menses, the loss of control over one's menses, and the anxiety associated with blood loss was the primary cause. For women who receive treatment for fibroids, the quality of life is a major indicator of what a successful treatment represents. So what is needed? Dr. Stewart already mentioned this, and it's really important that women don't want a hysterectomy. This is a standard treatment for uterine fibroids, and this is not something that many women want. And I think one of the major issues is that today we focus on treatment of the disease, but screening and secondary prevention, particularly for young women, is not done. And this is in contrast to many medical conditions where conditions of high prevalence have recommendations for screening and earlier diagnosis so that the disease can be interrupted before the severity increases. So for uterine fibroids, early detection of the disease and treatment is a lost opportunity. In medicine, the goal is to treat disease before complications arise, except in the case of uterine fibroids, where the current practice is to wait until symptoms are so severe that surgery is required. We need a different approach to this condition. Our current approach to the disease results in an average cost to the United States healthcare system of $34.4 billion a year. So not only does it bad from the standpoint of the women that are affected and the adverse effect on the health of women and their psychological and psychosocial impact of the disease, but it makes no financial sense. So let me put this into perspective regarding the amounts of the money that the U.S. healthcare system spends on most common cancers. You can see that the cost of the U.S. healthcare system due to fibroids on an annual basis exceeds that of most cancer care by a factor of 2. So despite the immense burden and impact on women's health of uterine fibroids, very few research dollars have been dedicated to the condition. So how many women are affected by fibroids? More than the population of the entire New York City. So in summary, fibroids are health disparities, significant delays in diagnosis exist. The impact on the fibroids equals the impact of many chronic diseases for which considerable amounts of money are spent on their prevention and cure. And no long-term treatment or prevention for fibroids exists. So women with fibroids need new options. Research is needed. And I want to thank, again, the organizers for bringing this topic to the forefront and Soteria for the invitation to speak today. Thank you.
Thank you so much, Dr. Segars. I'd like to introduce Jermaine Reid. Jermaine Reid has been the Fibroid Foundation ambassador for the Boston region for the past 3 years. She is a dedicated advocate for menstrual health equity and has a passion for supporting those suffering with fibroids so that they are not alone in their fibroid journey. Jermaine, welcome.
My name is Jermaine Reid, and I am here to share my story of realizing how vital it is to end the stigma associated with menstruation that affects so many women, girls, and people who menstruate. In early 2020, I had increasing difficulty leaving my home each month during my menstruation phase because the symptoms, including cramps and bleeding, dramatically increased in severity. By June, it became so bad that I had to use multiple menstrual products per hour. I said to my sister, I think something's wrong. She suggested I immediately seek medical advice. I was terrified. How did I get here? Please allow me to quickly share some background. Up to this point in my life, my menstruation experience was not something I celebrated. It was to remain quiet and to be controlled. This position was not from any family pressure, but rather that of society. The traditional view of menstruation was that women, girls, and people who menstruate should remain quiet about their problems and try to control any physical or emotional responses associated with periods. For example, in high school and college, I always ensured my menstrual products were well hidden from view. I always checked for the dreaded leak. I always pretended like I didn't have cramps. I took health classes, but only the physiological aspects of menstrual health were explained. There was no education that normalized the experience shared by half of our global population. Simply stated, my relationship with my menstrual cycle was always adversarial. All of my experience with concerning my menstrual health centered around making the issues go away. I never explored possible issues with any primary care doctor, and I did not probe for answers. So back to 2020 and terrified. There I was, June 2020, meeting with a new doctor, a leading gynecologist in Massachusetts, who explained that I had fibroids and that they should be removed as quickly as possible to prevent further severe symptoms. I later learned they were large, 7 in total, around 3 to 5 centimeters in diameter. As I said, I got good at ignoring the symptoms since I believed all aspects of menstruation should generally be quiet and controlled. I must always win the battle against my period. I did not know my menstruation was an essential indicator of my reproductive health. And heavier bleeding and increased cramps were all warning signs of potentially more significant health issues. I went home from my doctor's appointment to decide my next steps. At this time, in a distraught state, I found the Fibroid Foundation on social media at 2 a.m. The information they provided was simple to understand, celebrated the importance of menstruation, and provided me with invaluable education about fibroids. So I decided to fight back. I learned a lot, I prepared for my surgery, and in November 2020, I had a successful myomectomy. My experience profoundly impacted me. I wanted to help others, so I joined the Fibroid Foundation as a volunteer ambassador to provide support and educational resources for women and people who menstruate in my community. I am thrilled about National Menstrual Health Awareness Month. This recognition has tremendous potential to erase the stigma for menstruation and provide meaningful education for women, girls, and people who menstruate, ultimately improving the lives of many and leading to more significant positive health outcomes. Thank you again, Representative Meng, Representative Clark, and committee members.
Thank you so much, Jermaine. It's just a pleasure to partner with you. I appreciate your remarks. Now I'll introduce Lauren Kornegay. Lauren is the founder and executive director of Endo Black. Diagnosed with endometriosis at the age of 20, Lauren experienced the pain, struggles, exhaustion, and confusion that accompany the disorder. It led her on a search to find someone who looked like her, who was also dealing with endometriosis. Her mother always told her, and I love this, if there's a void, fill it. And if you want something done, do it yourself. Lauren believes in creating a space where there is no space. In October of 2015, Lauren established Endo Black, Inc., a platform designed to connect African-American women and women of color affected by endometriosis. Welcome, Lauren.
Thank you so much, Cecilia, and greetings, everyone. Today, as the founder and executive director of Endo Black, Incorporated, and a patient advocate, I address the critical issue of menstruating stigmatization and its profound impacts on women, girls, and people who menstruate. Today, we celebrate May as National Menstrual Health Awareness Month by introducing HR 351. This resolution holds tremendous significance for millions of individuals across our nation. Menstrual health is fundamental to women's health, yet it remains bound in silence and stigma. I'll share some alarming statistics to shed some light on the urgency of this issue. Countless women face financial difficulties, as he's mentioned earlier, in obtaining menstrual necessities, with 1 in 4 low-income women unable to purchase menstrual hygiene products. This lack of access to proper menstrual hygiene management can lead to infections and other health issues. Shockingly, over 20% of the girls in the United States have missed school due to lack of access to menstrual products. It is time to change the narrative and recognize menstrual health as critical to the overall well-being of menstruators. This inequity can hinder their participation in education, work, and everyday life. Moreover, we acknowledge the correlation between menstrual health and endometriosis. This chronic and debilitating condition impacts an estimated of 1 in 10 women of reproductive age worldwide. Early intervention and awareness are essential in addressing this often undiagnosed illness. Evaluating the conversation around menstrual health empowers individuals to seek medical care, leading to improved outcomes and increased quality of life. However, this isn't solely about those currently menstruating, but about those that are coming after us, the next generation. Young girls are often navigating this taboo subject alone, leading to feelings of shame and embarrassment. By raising awareness and promoting menstrual health education, we empower young girls to make informed decisions about their own well-being. The onset menstruation can be confusing and overwhelming, especially when we are met with silence, shame, and misinformation. So raising awareness extends beyond medical conditions. It encompasses the emotional well-being and self-esteem of young girls everywhere. By fostering open dialogues and ensuring comprehension menstrual education, we can offer an opportunity to empower them with knowledge and confidence to navigate this transformative stage in their lives. This congressional briefing is pivotal in our journey towards menstrual equity and health. By recognizing May as National Menstrual Health Awareness Month, we stand against the longstanding stigma surrounding menstruation. Together, we can eliminate menstrual stigma, increase access to menstrual products and hygiene management, and promote menstrual health education. I extend my sincere gratitude to the Fibroid Foundation, Representative Meng and Clark, and all of those championing this cause. Let us seize this moment to engage in education, engagement, and encouragement. Together, we can create a world where menstruation is no longer taboo, and all women and people who menstruate can live healthy, empowered lives. Thank you so much.
Thank you very much, Lauren. Next, I'd like to introduce Sasha Ottey. Sasha is the founder and executive director of PCOS Challenge, the National Polycystic Ovary Syndrome Association. Sasha has a master's in healthcare administration and is a certified medical technologist. She started the PCOS Challenge after she was diagnosed with PCOS and experienced great dissatisfaction with the availability of support resources for women with the condition. Sasha has built a coalition of over 70 major national and international health organizations and led the first successful legislative advocacy effort in the U.S. Congress to recognize the seriousness of PCOS, the need for further research, improved treatment and care options for a cure for PCOS, and to designate September as PCOS Awareness Month. Sasha also created the PCOS Awareness Symposium. Welcome, Sasha.
Thank you so much, Soteria, for inviting me to be here, and for Representatives Meng and Clark for supporting and sponsoring the May Menstrual Health Awareness Month resolution. It's really important because as we were listening to the previous talks, I saw myself in much of the presentation and many of the things that they were speaking about. And if you're a menstruator or a person who loves someone who menstruates, which is likely everyone here, this topic is really important. I founded PCOS Challenge after my own diagnosis and being dismissed by my own physician. I went because my periods had stopped and that wasn't normal, right? Menstruation is a sign of health. And my doctor told me, well, not to worry about not having my period because there are plenty of women who would love not having their periods. And everyone here knows that that this was a missed opportunity for that physician to educate me on the connection between my menstrual health, my overall health, my mental health. And unfortunately, this story is not uncommon. We hear this time and time again of people being misinformed or dismissed upon getting a diagnosis such as PCOS or endometriosis. PCOS or polycystic ovary syndrome is the most common hormone or endocrine disorder affecting women. And PCOS, you would think, has a hard diagnosis, but it doesn't. It's diagnosed if you have irregular cycles, which means if you menstruate less than 25 days or greater than 35 days, or if you have signs of high androgens, such as facial hair, excessive facial and body hair, or severe acne, or if on ultrasound, there are these little immature follicles or enlarged ovaries and called polycystic ovaries. And now an update to the diagnosis is if you have a high anti-Mullerian hormone level. And so that's it. If you have an irregular cycle, that's one of the first signs of PCOS around puberty. Yet a lot of people in retrospect will recall being told, oh, that's just normal puberty, or just being dismissed and going years or over a decade without a diagnosis, and then getting diagnosed at a later time when they have difficulty getting pregnant or have pre-diabetes or another comorbid condition. So our menstrual health is a sign of health. It's, as we heard before, is the fifth vital sign, yet it's often being dismissed as just something that we experience and isn't given the appreciation that it requires. I also had a diagnosis or have a diagnosis of fibroids, which like Dr. Segars said, I went years without getting any intervention. And just as Jermaine did in November 2020, had a myomectomy. And this was during COVID, where you couldn't have any supporters in hospital. It's a lonely time to be having such a serious surgery, right? And so I see myself and I see my friends in all of this discussion, and the stories that we hear about people being dismissed and our quality of life and our financial futures being impacted by this dismissal, by not giving menstrual health the full appreciation that it deserves, is criminal at times. It really does affect people throughout their lifespan and throughout and their quality of life. So putting this focus on menstrual health, connecting it to overall well-being is something that we are at PCOS Challenge proud to help to champion and support. And just thank you very much to the organizers for your leadership, and thank you to our congressional representatives for your support.
Thanks so much, Sasha. Next, I'd like to introduce Michela Bedard. Michela is the Executive Director of Period She has a distinguished history of experience in advocacy. Period is a global youth-driven nonprofit that strives to eradicate period poverty and the stigma through service, education, and advocacy. Through the distribution of menstrual products, promotion of youth leadership, and championing of menstrual equity and policy, Period aims to center those disproportionately affected by period poverty and to support local efforts for menstrual equity. Michela, welcome.
Thank you so much. Thanks to Soteria, the Fibroid Foundation, for hosting this briefing, and to our champion, Representative Grace Meng, and Representative Clark for introducing this resolution. As Soteria said, my name is Michela Bedard. I'm Executive Director here at Period. We are a global nonprofit headquartered here in the States, working to end period poverty and stigma through our three main program pillars of service, education, and advocacy. We are proud to be powered by our 400 period chapters, who are largely youth-led, and they help Period's programs distribute millions of pieces of period products to Americans in need across the country to help us create destigmatizing curriculum about menstrual equity and period poverty, as well as, Soteria said, advocate for menstrual equity policies in local, state, and federal governments. I'm going to take my time today to speak about period poverty and how this resolution can help make a big step towards ending this crisis. So period poverty is defined as the limited or inadequate access to menstrual products or menstrual health education as a result of financial constraints or negative socioculturally stigma associated with menstruation. So what Period does is we work in coalition with local period chapters and grassroots activists across the country. And we get to talk to students every day, from California to Idaho, to Texas, to Florida, to North Carolina. We get to hear their stories about how access to period products and knowledge about their periods can positively affect their life, how they are more able to attend class, engage in school, in work, in their everyday activities that allow them to be their true selves when they have access to the products they need and when they have the ability to advocate for their own menstrual health. And at Period, we get to work with families who tell us that an extra few dollars at the end of the month, when faced with purchasing unaffordable period products, can make a real difference in their lives and the lives of their children. Because here are the facts. Our original research, the State of the Period studies, show that nearly 1 in 4 United States students struggle to afford and access period products. Students of color, low-income students, rural students are most impacted by issues of access, and that the majority of student respondents in this study report that they have either missed class or know someone who has missed class due to their periods. And it's not just about access to products either. 3/4 of students report that they know more about the anatomy of a frog than the anatomy of a woman's reproductive system. But here's the good news. This is a solvable problem. This country knows how to use policy to provide all sorts of products to people in need and to support folks who are reliant on government assistance programs. And so creating this awareness month will help people at all levels of government, as well as all Americans, more openly discuss menstruation and the needs of the people who menstruate. And the other good news is that this is an issue that can bring us all together. Over half of Americans experience this monthly. And so as Period works across this country, it's been really great to see people on both sides of the aisle come together in local jurisdictions, school districts, and state legislations to support policy change, from providing products in schools to repealing the tax on menstrual products. Because this is an issue that affects over half of all Americans, it's amazing to see us come together to create and implement policies like this resolution that will help ensure that period poverty does not hold Americans back. This truly isn't a polarizing issue. It is a joyful issue to work on in coalition with so many people, like the activists on this call, but so many grassroots activists and young people in this country who are taking up the mantle of ending this crisis in their lifetime. And so this resolution to make May Menstrual Health Awareness Month is a real solution to get us one step closer to ending period poverty. Thanks so much for your attention to this critical issue. I am so glad that we are one step closer to, as Representative Meng said, taking a whole of government approach to ending this crisis.
Thank you so much, Michela. In closing, I would like to thank our distinguished speakers today and the advocacy organizations who endorsed the resolution. They include the American College of Obstetrics and Gynecologists, Girls Inc., Period, Alliance for Period Supplies, Black Women's Health Imperative, Care USA, Congressional Black Caucus Foundation, Black Days for Girls International, the Dartmouth Institute for Health Policy and Clinical Practice, the Geisel School, the Endometriosis Association, Healthy Women, National Organization for Women, Endo Black, the PAD Project, PCOS Challenge, the National Polycystic Ovary Syndrome Association, PAI, the Red Alert brand, Society for Women's Health Research, the University of Chicago Departments of Obstetrics and Gynecology, and the White Dress Project. We look forward to annual recognition of National Menstrual Health Awareness Month, culminating each May with internationally recognized Menstrual Hygiene Day on May 28th. I thank Representatives Grace Meng and Yvette Clarke and their offices for making the introduction of House Resolution 351 possible. Please contact your representatives to voice your support for House Resolution 351. And thank you so much for attending today's briefing. Be well.